And we are honored and privileged today to have Dr. Kuperburg as our keynote speaker.
Thank you very much. And I'm so happy to be here today. And it's, such a pleasure to be able to speak with you. But it's kind of interesting. And like I said, my name is Kuperburg. Very fascinating that when I was asked to speak here, I knew that I was speaking to patients, young people with cancer and their families. And I said, what can I give to you? You are the experts in this. So I want to acknowledge the fact that I have worked with people for over 25 years, young people and their families for 25 years, but that really you are the experts and can give, and I learn, by the way, every day I learn from the young people that I work with and the families that I work with. So, and this is where my talk comes from, is from my work, my 25 years of work with the Teen Impact Program. So let me tell you a little bit about the Teen Impact Program. Okay, so like I said, Teen Impact has given me the special opportunity to learn from thousands, and I mean thousands, because it's been 25 years of young people with cancer and their families. Few programs, back in 1987 is when we first established it, few programs had really been there to help teenagers navigate the cancer experience. And so I can easily say, and I'm very honored to say, that Teen Impact as a program is really a pioneer. Being a teenager, as many of you know, having had the experience, is hard enough. But being a teenager battling an illness such as cancer can be very challenging. The psychosocial needs of this age group are distinct, and the experiences during the stage of life are important to an individual's long life development. So it's not just for today, it's for a lifetime. The psychosocial needs of this age group, like I said, are distinct. And like I said, the long-term effects are there. That is why that I knew, and I did it with a few of my colleagues, it wasn't just me, I will give credit to others too, that it was imperative to fill in the missing pieces with a program like Teen Impact. And I am proud to say that it is the longest running program, psychosocial program of its kind, and that our year-round services offer consistent and unique programming that, by the way, has only been canceled once in our 25 years. And that was for a very, very good reason. It was the night that the LA riots broke out. So that was the only time we've ever had to cancel a program. And I'm going to tell you a little bit about what we do. And this is before I get into kind of what I've learned from everybody. But what we do in our program is we have many different components. One thing we have are year-round groups, and these are support groups, and we have found that it's important to have it both for families and patients. And these support groups are nestled into a These support groups are nestled into a whole evening, a Monday night evening, that we have informal programming at first, then an hour dinner, and then the groups for like 6 concurrent groups that also, like I said, we focus on not only the patients, but all family members. Our flagship 3-day retreat, which are the psychosocial retreats, are for ages 13 to 19 years old, and we give 40 young people, some who have never been out of the city, a wonderful experience, an amazing place in a woodsy outdoor venue with luxurious cabins outside of Santa Barbara. I don't know how many people have ever been to, I'm from Los Angeles, and have ever been to Santa Barbara, but it's a beautiful, beautiful city. And in this atmosphere, we give teens a chance to enjoy independence, which many of them haven't because of their treatment, but also just because of the situation of being even a survivor of cancer. Sorry, I have my water here. And we do this, we get them away from their worries, and we do this with a combination of, and this is our kind of model, a combination of discussion groups and all kinds of therapeutic activities and workshops, like self-expression workshops, like yoga, and we have journaling, art, different kinds of self-expression workshops, and of course our most popular events, which I'm sure everybody can relate to, are the dance that we have on Saturday night. That's the best. As role models on these retreats, we have young adult survivors. And these young adult survivors are there to mentor and give back. And it's a beautiful, beautiful thing because it not only helps the teen participants, but the young adults as well. And of course, they're there to give support, encouragement, and hope to the younger members. These young adults, in turn, have an opportunity to give back and feel good about themselves. We also have parties, and we're fancy. We call them social rehabilitation events throughout the year. But they're really holiday parties and other events where teens and young adults can just have a chance to have normal times together. And now we're very excited in 2013 to launch a webcast. And this is a webcast of our live teen group that we're going to be doing. First, we're going to webcast it to the most isolated teens, and that's in the BMT units. And see if that really can give them an opportunity to interact with others that are out there and also give a lot of hope. So I'll tell you, I'll kind of keep you abreast of how that works out. So we're hoping that's going to be a really wonderful program that can start not only in the BMT unit and then next to other hospitalized teens, but then beyond the hospital walls to other institutions. We have inpatient, weekly inpatient groups and individual treatment, and we have a highly selective training program for doctoral level psychology students. And these, the students really help us run all the different programs. So it's a wonderful combination of a very small staff of many students and then many volunteers that helped this program survive and helped us survive for the last 25 years. Okay, so who do we serve? I just want to quickly go over that. We serve, because we've recognized that life is about transitions, we decided to begin with our preteen years, and we have a group for preteens that are 7 to 12. And these, the next distinct age-related group we have are the teen group from 13 to 12. And young adults 20 and up. So we really try not only to define but work with kids, young people that have issues or need the extra help in those different age groups. And of course, we've grown to be family-based and provide bilingual groups for parents and also two groups for siblings, for those under age of 12 and those 13 and up. We serve patients both on and off of treatment. And at first, when we first started, we just assumed, and I want to know if maybe this is something that you could identify with, that we first assumed that the greatest need for the group, like Teen Impact, would be those who are on active treatment. But what we found was very different. Many of the teens that participate, or began to participate back then, and still do, were off of treatment, and some of them way off of treatment. So it really kind of tells you that there are needs of some childhood cancer survivors who still can gain a great deal from peer support. And as Heather kind of acknowledged earlier, it's not everybody. Everybody is different, but there are some people that are still needing of some other kind of support, even way after treatment ends. Although most of our members have been diagnosed with cancer, we are also open, our services are also open to young people with blood diseases. So we also treat both cancer patients and patients with blood diseases. Teen Impact membership truly reflects the demographics of Los Angeles, with a membership that is ethnically diverse. Since many of the parents are Spanish-speaking only, we have interpreters, which I know you have here too. And our parent group, which is really interesting, and that's what I do now. I've kind of graduated myself from being a facilitator in the teen program to really working with parents. And we have, because of the parents wanting this, we actually mix the Spanish and English parent group together and have an interpreter that bilingual simultaneously. And it's really worked out well. And I think the feeling is that the common denominator is really the cancer, not the background or the language. We welcome patients and families from any treatment center, and all of this is offered at no cost. What makes Teen Impact unique and different from other programs is our hybrid psychosocial model of offering therapy and social packages and social activities in one package. And as you can see here, this is our package. Kind of one doesn't go without the other. We always offer both at the same time. And our mission is to deal with the emotional side of the cancer experience and help normalize the diverse and natural feelings that arise throughout the journey. One of our long-term members wrote in his college essay that Teen Impact was his, quote, emotional life raft, and the one thing that got him through his cancer experience. Connections made through Teen Impact oftentimes remain for a lifetime. At least this is what was told to me by Susie. She's 40 years old, and I met her recently at a cancer survivors conference in LA. And she said that she is still in contact with the original members that she was with in 1987. By the way, she was one of these unbelievable students who came to we'd have these group meetings, and she'd come with her homework and do her homework before the group sessions, not during. And she ended up getting a full scholarship to Stanford. So quite an incredible person and individual. And now she's a school teacher and has a child. And she tells me that she is still in contact with those people that she met in 1987, and that she still gains a lot of support, mostly through Facebook and things like that. But it's been very helpful for her. And she credits Teen Impact for that, for being able to meet these her friends, her lifelong friends. Okay, as you can see, there's a tattoo that says Survivor. This is a young man who is now about 35 years old, and he was diagnosed with leukemia at age 4. Lloyd became a member of Teen Impact and later a counselor on our retreats. And as you can see from his tattoo, it really illustrates what being a survivor means to him, and it means a great deal. He wears the badge of survivorship permanently where everyone can see it. At 27, Joy, who was another survivor, documented her cancer journey on a film and opened it with the statement, quote, "I am Joy and proud to be a cancer survivor." To be a survivor has a unique meaning to everyone, and I say it's very unique. Not everyone shares the same meaning of survivorship. I am sure all of you have identified yourself as a survivor at different times in life. At different points, I mean, along the cancer journey. And it's a very personal decision. Does being a survivor begin at the time of diagnosis, when the battle begins? After your first round of chemo? When you come off of treatment? Or when you have years cancer-free? The medical world may define survivorship very differently than what you personally have come up with as individuals. Whatever survivorship means to you, the number of childhood cancer survivors are growing and is now a fact. And I heard this new number, that 1 in every 640 adults are survivors of childhood cancer. Okay, like I said, this is a snowflake, and snowflakes definitely represent uniqueness. Every snowflake is different. And that is the point I wanted to make about your survivorship experience. No matter where it starts for you, depends on your own storyline. Your story is made up of a host of unique characteristics. And I listened to Heather's characteristics, and they may be very different than yours. And what the kinds of questions I like to ask in terms of your own personal story is, What were you like before you were diagnosed? What was your family like? At what age were you diagnosed? That will make a big difference. What type of cancer did you have, and what sorts of treatment? What are your personal perceptions and beliefs? What was your school experience like? And how about your support network? And they're all different. Everybody sitting here has a very different story. Okay. So reflecting on these questions highlight how survivorship is a very personal, individual experience. However, there are some factors that involve family, communication, relationships, self-image, transition, and psychological adjustment that have some common ground. In other words, cancer edits a patient and their life story in ways never anticipated. First, I'm going to talk a little bit about family. And like I said, everybody's different. But a person we know doesn't exist in a vacuum. It is not only the individual who is battling cancer, but the entire family. And the impact can last a lifetime. Here are some several very specific areas where family dynamics can make a difference for the survivor and other members. First of all, parental and family functioning early on, that's right after diagnosis, influences the functioning in children long term. There has been some studies that talk about that talk about how early maternal and somehow they always kind of do it on mothers. That seems very unfair. But they have done studies on maternal distress and anxiety and depression and have found that it really, those kind of early experiences in the family does impact the long-term adjustment for the patient. There's also a study that talks about the higher incidence of PTSD. I don't know if people know that. It is post-traumatic stress syndrome. And childhood cancer survivors, and found that mothers who had PTSD themselves also had children that tended to have PTSD and also. Okay. I think another thing I want to emphasize, and like I said, everybody is different, but what I found, because, I run this parent group, and what I have found is that parents many times tend to cope very differently with the cancer experience. And this can have long-term impact. Males, and this is a general thing, generally keep emotions in, and females express them. These differences can be problematic at the beginning, and if not addressed, may continue to be an underlying issue that may cause marital discord. This is, like I said, I have not seen this in every person that has come to our group, but there is a common thread that this may occur for some. Just recently, a father in the group, there's a father in our group that expressed really, actually he cried when he shared that his wife, for the past 3 years, his child was diagnosed 3 years ago, and he was not able to be there for the child at the beginning, primarily because of his job, which is a very, very common thing that happens with families, but that he still feels the guilt from not being able to be there. And it seems in this case, the mother blames him too. So it's the blame and the guilt and the conflict he felt at the beginning for not being able to be present. I think this is something that happens with some families, and I thought I would bring that up as one of the kind of points that affects survivorship. The loss of normalcy is felt by each member of the family and may be experienced in very unique ways. And for some, I think the sibling experience is one member who really has it appears to have the most difficulty in families. It's not always true, but it can be. But what I have seen is that because of the fact that parents naturally focus more attention on their child with cancer, siblings may feel abandoned. And I don't know how many people here have had that experience or may have felt it at different levels, the intensity, but this is something that could be, it feels more common than not. And yet the siblings, because it's an interesting phenomenon, but siblings can have feelings of anger and jealousy. And these are normal reactions that may actually result, these are anger and jealousy towards their brother or sister, and yet may then have guilt feelings. And how could you possibly be angry at your brother or sister who is sick? A story told by a young adult survivor really stayed with me. This woman had been diagnosed with leukemia as a child. And years later, her sister was diagnosed with cancer. And as a young adult, she reported that the experience of being a patient was far easier than being a sister of a patient. So I thought that was really a dramatic message. And it stayed with me. I heard this quite a long time ago. Another point I want to make about parenting, and I know that parental overprotection is natural. At first, it is beneficial and it's absolutely necessary. Being vigilant is important for a child's well-being. But the benefits of being vigilant in the beginning can be detrimental in the long run. Overprotective support may lower a child's self-esteem and self-confidence and prevent growth. In a recent parent group that I ran, members were discussing, and I know this is something that teenagers and young adults may be able to identify with, and that is that members were discussing, and these were parents, were discussing how important having a sense of control was for their teens with cancer. When a mother suddenly chimed in that, what do you mean a sense of control is needed for the child themselves? Parents need a sense of control. And she claimed overprotecting her daughter was her only way of gaining a sense of control. So it really got me thinking about that in a different way. So many times overprotection by parents is because they too need a sense of control. Overprotective support becomes more of a problem for older adolescents and young adults. At a time when achieving independence from parents is a developmental norm, difficulties in letting go may derail the process. Our parent group spends much of the time sharing how difficult it is to let go, especially for young people who have cognitive deficits. A mother at a recent group meeting told me that she spent her life trying to help her child survive, and now she's trying to help her child live. And live, meaning live independently and be on their own. Recently, a group of medical students came to our Monday night meeting. They kind of hung out with the teens and the young adults during our dinner hour that I discussed. And they were talking, and I saw them laughing and having a great time together and really getting to know each other. Then the students, these medical students, were invited to participate after in our parent group. And we go around the room, and the parents introduce themselves and talk about their children to the medical students. And what they described were children that were so sick and impaired. And I thought to myself, it really brought to light for me how there's different perceptions that children and young people with the illness and families and parents have very different perceptions on the illness and how it impacts their life. Another important thing that made me think. Okay, communication. Lack of communication can create psychosocial issues for survivors. One author noted that, quote, the loneliest of children were those who knew of their fate but could not discuss their future due to their parents' inability to communicate. Isolation and loneliness comes from difficulties in talking to each other in an honest, open way. Although there is a need for open, honest communication, more often than not, there is a lack of communication. Hiding true feelings stems from a misconception that people need to be protected. And I don't know if that's something you can relate to, because I hear that a lot in families, that really everybody's trying to protect each other. For parents, the misconception is that sharing honest feelings could make the illness worse and leave the child without hope. The child or teenager may think that sharing their honest feelings and fears may overwhelm their parents. Putting up a strong and positive front, however, may leave the young person with cancer feeling a profound sense of isolation, even in his or her own family. I met a woman in her late 20s. I didn't know her when she was first diagnosed. I didn't know her when she was a child. But she had been diagnosed at age 12. When I asked her about her experience at the time of diagnosis, she replied without a beat that the burden of keeping up a positive facade for her parents was the most difficult thing she has ever had to have done. Now, I mentioned Joy, who was this 27-year-old survivor, and Joy, she made a video journal of her cancer experience. This was when she was in film school, and it was quite an eye-opener and profound piece of work. And she highlighted, and now she didn't say this, but I could see by, no, let me just step back and tell you, video journaling is when she actually spoke into the camera when she was alone, and she also filmed her whole experience with cancer. So when she spoke into her camera alone, she was really speaking from her private self and expressing how she deeply felt. When you saw her in public, she showed a whole different face to the world. And we know we all do that in life. I don't think you have, whether you have had been diagnosed with cancer or have had experienced a serious disease, we all have our private feelings and our public feelings. But this film really kind of brought it to life, how a person can look into a camera. She cried, she struggled, she had to give herself coaching. She coached herself and really gave her a lot of, push to struggle through this. You're going to do this. And then to the public, she did not show that face at all. So recently, Joy came to a class of medical students. And in that class, she actually said, she kind of talked about her experiences early on and said that her need to be strong and to be fortified, was something she actually even shared to her oncologist, that she didn't tell him either how she felt inside. And this is something she kept inside for a very long time, until she said that a year later, she experienced post-traumatic stress symptoms. Those were kind of nightmares and fears and a lot of anxiety, and she sought psychological treatment. So this, like I said, is a general statement. It's not something that applies to everybody, but keeping feelings inside sometimes doesn't automatically erase them. Relationships. As everybody knows, relationships, both peer and intimate, are vital ingredients to experiencing a full life. Yet, the missing chapters, and I don't know if people here can identify with this, that the missing chapters that young people experience following a cancer diagnosis may interfere with the development of normal relationships. I was so happy to hear from Heather that was not, something that really that was a positive and it kept true. So like I said, it doesn't happen to everyone, but for some it does. And the restrictions during treatment and the stigma of being a cancer patient may jeopardize peer support. There are simply fewer opportunities to interact with others during treatment, and the lack of normal experiences may cause a social delay and delayed social maturation for survivors. So really, depending on the time of life in which a person is diagnosed, these social changes may determine just how the rest of your story reads. I just want to put up another thing, and I don't know if people here have ever experienced this, but bullying. Bullying is something that comes up a great deal in our groups. And it is a problem in general. You hear it on TV, you hear it in the media. But it's even more so among our long-term survivors at Teen Impact. They talk about it quite a bit. And a study in 2002 found that childhood cancer patients are 3 times more likely to report being bullied than healthy peers. So it is something that is recognized even in the literature. Okay. Now, I know that another issue around relationships is establishing romantic relationships. And I think one of the things that have come up regularly in our group is, if you're in a relationship, do you tell that person that you have cancer or you had cancer, and when? And I think that's such a personal decision, and it really depends on you, and it also depends on this relationship. Is it a trusting, quality relationship? Is it something that you think this person is ready to hear? I think kind of similar to that is the question of infertility, and how does someone share this with another one, and when, if that is something that is a concern that you have. Okay, another area that I think could be impacted by during the stage of survivorship is self-image. Now, as you know, if everybody, people who are teenagers here, or those that are not far from being a teen, or those that are even older, I can remember my teen years and feeling very self-conscious. So that this is, I think self-image can be something that's impacted when you're diagnosed with cancer or when you're a long-term survivor. But much of how, I would say the degree of impact really depends on the perceptions. That's how do you perceive these limitations? And they don't always actually depend on the visible and actual disabilities. So there has been a study that has said that many survivors meet the challenge of their long-term side effects with courage, and that they don't really focus on their disabilities. So it's more about the perception of your disabilities than about the actual limitations. Another study that I've read on adolescents off of treatment found that the longer an adolescent is off of treatment, the more they perceive problems related to self-worth, social anxiety, and greater negative perceptions of body image. One explanation may be that the crisis mode during treatment prompts better coping skills, or such as denial. And this may be one explanation on why most of our participants in the Teen Impact program are off of treatment. Okay, transitions. Well, transitions means changing from one stage to another, and transitions are challenging for anyone. In general, I think trends have changed a great deal. For all transitions, when I say like life stage transitions. So the adolescent stage has extended in years, even for the healthy young people, as it takes far longer to become financially independent, and people staying in school longer. There are many reasons. The trend for adolescents in general is to live a longer period of time at home. But of course, the cancer experience during childhood adds another dimension to transitions experience over the life course. Transitions may bring up new challenges, but also can rekindle old ones and possibly new tensions in the family. Transitions also may create new difficulties such as financial independence and insurance problems, as one knows, as you kind of move into young adulthood. My thought is that the process of transition is not linear. It doesn't just go forward in one way, but there could be one step forward, 2 steps back, and that it's a process, but not one that takes time, and that takes a lot of time, effort, and patience for some people. Okay. What are some of the psychosocial issues related to transition? One of them is moving from on to off of treatment. I have found, and I want to know if maybe you relate to this or not, that parents, as off of treatment, as kind of completing treatment comes up, parents feel very frightened that this is a time when you're losing your security blanket. I hear that from parents a lot. And they're kind of fearing the relapse and missing the support of the medical team. For teenagers and young adults coming off of treatment, I think there is at first a real excitement. Oh my gosh, this will finally end. But some may still have fears after treatment ends, when the first scan, you have to go in for your first scan, or you go back for your annual visits. So I think that there is some difference when at the time treatment ends. The transition, another psychosocial issue related to transition, is the transition from adolescence to young adult life stage. The difficulties experienced with this transition has a lot to do with the accomplishments of the normal developmental tasks for all adolescents. That includes identity formation, positive self-image, establishing independence, and future orientation. I think the greatest pitfall that gets in the way of completing these tasks is the over-identification as a patient. A term, I think that, I don't know if you've ever heard of the term learned helplessness, but sometimes if it, it's a term that is really is defined by behaviors that are learned. And these are behaviors that are learned early on. There are patterns that can develop. If one is a patient and is treated as a patient all their life, then this is something that kind of stays with them. And this learned helplessness, if it's reinforced, is a very hard change to make overnight. So putting the cancer experience in its proper place and using it as only one of the many ways of defining yourself will help young people move to the next stage. Now, I find that parents, like I said earlier, may have more difficulty making this transition and allowing children, allowing them to letting go in some way. And this fear can be real because some patients who have a greater cognitive deficits and may have more difficulty living on their own, there may be, the concern of what will happen when they're gone. So just finding a real safe place could be a real issue. To help older teens and young adults define themselves, it is important for parents to treat them according to their age. The young adult members of a recent group seem to agree on a common experience that they've had, and I never thought of this until they brought this up. But parents who just disclose, kind of discuss their cancer in front of other people without their, without allowing the young adult to, to say whether that's okay or not. So I think you need to make sure that you consider the privacy and confidentiality of your adolescents and young adults as parents, and that things change over time, that perhaps you could have talked about it in front of them to other people at one time, but once it's at a certain age, it may not be okay, and it may be nice to check in with your child. Psychological adjustment. Studies shows that most childhood cancer survivors adjust well, and that the psychosocial effects are just more subtle. And I would say there are some groups who have a more difficult time of adjusting, and that, of course, is those that had greater impact on their central nervous system from disease and treatment, and those from more dysfunctional families. Both of these groups are at higher risk for adjustment problems. But like in general, I said, people adjust fairly well. There is kind of the newer studies really look on quality of life. And what has been found about quality of life in survivors is that most survivors reported being in good health. Most survivors function well psychologically. Survivors of CNS tumors and survivors of ALL are at risk for educational deficits, perhaps. These were things that were found in kind of looking at all the studies. Job discrimination, difficulties in obtaining work, and problems in obtaining health and life insurance were reported, and survivors have lower rates of marriage and parenthood. Survivors worry, and I think worry is a key word, because I think that there may be more worries than there are actual psychological problems. But a lot of things they worry about are their reproductive capacity, or about future health problems their children might experience as a result of their cancer history. And worries, I think worries is a good way to say that that's really many times the experience of survivors are more the worries than the actual psychological problems. But before I get to this, I just want to say key elements critical to psychological adjustment are, I think I mentioned it earlier, kind of the perception of the illness severity. And like I said, there have been studies. There's one in particular that said, had a questionnaire on the impact of illness. And the questionnaire found that the higher one's self-perceived impact of illness, the higher the expression of anxiety and lower self-esteem. Recommendations that were made on an article I read was that, you may not think like an optimist, but at least try to act like one, and it kind of works. So I like that. That's a good, I think, a good message. Also, resilience is the ability to return or recover after a trauma. And I think it is a characteristic, I have read, that can be learned. And anybody can learn to be resilient. May need some help from professionals or a peer network, but it is something that can be learned. Now for the more positive outcomes that affect psychosocial functioning of survivors, these are things I have seen in my group. And I'm sure maybe you have seen it too in your lives. But there seems to be an increased empathy. That's what I see in my group. I find that our members help each other in a beautiful way. There is, there are young people that are in wheelchairs or that are blind, and they are just out to help each other in a very, very important and meaningful, profound way. But more importantly is the acceptance that people can come into our group with all kinds of levels of functioning and, like I said, with all kinds of limitations, and it just seems like they're accepted no matter what. Related to this is altruism, or the wanting to give back. Many times I find that both patient and parents really want to give back in some way. And I just want you to know giving back, what they really does raise one's self-esteem. And it kind of it certainly gives meaning to the experience. Wisdom, and I think Heather actually, I keep on saying Heather, I just want you to know thank you for all this information, but you really kind of, you touched on this, but I find that despite the fact that a cancer diagnosis may create a social delay, that somehow there is a wisdom, but faced with a life-threatening illness gives someone a wisdom that nobody else their age has, and I think it's a really important piece of information, an important factor in the psychosocial development of survivorship. Post-traumatic growth. I don't know, has anybody heard of post-traumatic growth? It's a fairly new term, and I just am liking it so much, and it's something that I've seen a lot in my groups. It's a new paradigm that people don't just survive, but they thrive. And studies suggest that survivors may grow emotionally stronger than their healthy peers and more emotionally coherent and centered than they had been prior to diagnosis. And this is true. I can, talk about a couple of studies that have underscored this point, and the fact that really people do somehow benefit from the experience with cancer. I know nobody would choose to have a diagnosis of cancer, but many of our young people have said, and looking back, I wouldn't want it any other way, that somehow it made a difference and it changed their life in some dramatic way. And I know that one of the other things is reprioritizing of goals and lifestyles. It does. We had a young person many years ago who came, and she was a gang member. And as soon as she was diagnosed with cancer, there is no way she was going to be a gang member. So there are definitely changes. People reprioritize their goals and their lifestyle when faced with the diagnosis of cancer. And of course, it has very long-term impact on survivorship. I didn't put up there meaning and purpose. I just feel that sometimes being faced with a life-threatening illness can give, in retrospect, a sense of meaning and purpose, and that it really directs where you go in the future. So, what can you do? The first thing I have up there is, I should look here. My experience with working with families, especially now with parents, is that all emotions and reactions are normal. And I think that's an important thing to remember. Recently, a father had a great strength, an incredible strength to say ask in our group. He looked at the other parents and he said, my child, now his child was on active treatment, and they were away on a vacation, he and his wife, and they had to be called back because something, she had to be hospitalized. And this is, of course, an extreme example, but he did ask the group members whether they ever felt, the parents, ever felt angry about their child having cancer. Now that is quite a question. Now I want you to know the group went quiet. I felt for that father because that is such a hard thing for anyone to admit, that there would be any feelings of anger. Now, there may be anger towards God. There may be anger in many different ways. But just the fact that you feel angry is okay. Another important feeling that I think parents need to recognize is the guilt feelings. Guilt, what did I do? Did I do something wrong? Did I not bring my child to the doctor early enough? There are many, many guilt feelings, and that's a normal feeling. So just to know that whatever you're feeling is normal. Another important thing I've begun to understand with my 25 years in working with families and patients is that even in a supportive family, a young person with cancer may at times feel isolated, and that reaching out to each other, protecting each other, reaching out to each other is important. I have a question in my group that comes up quite often: should I cry in front of my child? My feeling is that there, and maybe this is different for everybody, there's a big difference between showing that you are concerned and are there with your child, with your child's concern, and very different than falling apart. So I think that there is a difference, and I think there is a way you can show it without also saying that we're not in, we're in this together and we're going to work on it together and fight this battle. Acting out behavior may be an expression of anger, hurt, sad feelings, and it may be a red flag. I know for some siblings, many of our parents have talked about their siblings, just really acting out, having, behavior problems in school and at home. And I do think that that's a red flag, and it's an important thing to beware of and go for professional help. So that it's important to be sensitive to every member's feelings, listen, observe nonverbal behaviors, and check in. Make sure that there's quality time for everybody in the family, even if it's 5 minutes, 10 minutes. Don't think that what you are experiencing matches your child's experience. Patients, especially teenage patients, many times are more concerned about their hair loss and scars than about the possibility of death. So it may be very different for the parents and for the children. And perceptions do change over time, so check in. Coping differently may cause lots of anguish, especially between parents, like I said earlier. So it's important to be able to identify that and know that people deep down inside, no matter how they are outwardly expressing or coping with the situation, deep down inside are hurting just as much. Okay, take-home messages. Oh, I'm right on time, too. Okay, take-home messages. And these are just general thoughts to bring home. First, I love this one. It's cute. One size fits none. Because survivorship is a very unique and individual experience, comprehensive services will not serve as one size fits all. But there is something out there for you if you need it. And make sure you take advantage of it, no matter where. And it doesn't matter, no matter if it's at the beginning of treatment or long term, because things change over time. And it's important, very, very important, to acknowledge that there may be help that is needed. Oops. Adolescence is coming. I like that. I thought that was a cute one for saying, prepare for the changes ahead. Whether it's adolescence, young adults, taking on the responsibilities of young adulthood, transitions are inevitable, so start early. Transitions are not just for the patient, but for the whole family. I like this one too. I am normal. Or am I normal? I guess she's asking. Yes. What I say is childhood cancer survivors are normal. And they have just had to live through an abnormal situation. So bringing normal back into lives as soon as possible is extremely important. And finding a new sense of normal is a real challenge and very, very important. And then my last, which is a checklist. And I thought, well, this is a good way to think about, once again, going, kind of anticipating any potential difficulties early on and develop preventive and rehabilitative strategies. Assess for psychosocial needs along the life course. It changes over time. Take advantage of mental health services along the life course. And for parents, this is what we stress in our parent group. Take care of yourself. Give yourself quality time. It's okay to take time away, to exercise, to read, to relax. It is okay. And it's important to kind of replenish yourself to be able to cope with what's there and what's ahead. And that's it. Thank you very much. And I hope there is something, like I said, everybody's different. I hope that the understanding that I've had from my many years working with parents and young people have hopefully something has been helpful for you. Thank you.